But if not, may we then move on straight away, Simon, please, to you, the Chief Executive's report.
Thank you, Malcolm. I just would start by underlining something that we said last week, which was to place on record our thanks to the staff of the NHS in London who responded to the Westminster attacks so effectively, and in the case of the staff from St Thomas's running across into the line of danger bravely. I think the NHS response across London has been, as you would expect, magnificent, and I think we owe a debt of gratitude to all of the, not just the paramedics, but the doctors, the nurses and others who've been involved in looking after the people arising from that attack. We've said that before, but I think it's right to record that here in this public meeting. More prosaically, the executive group has been out and about around the country, and so we've had our recent executive group meetings since we last met in various places, including Hull and Whitstable. I've had the pleasure of attending 3 public accounts committees since we were last together, discussing health and social care integration, GP access, which we'll talk about with Ros this morning, and yesterday Jane and I did a session on progress on learning disability services, and I think that was a good discussion that reported the views of the NAO that we agreed with, that frankly there had not been enough progress between 2012 and 2015, but since 2015 we've really begun to get some momentum in that programme. So I think we agreed with their assessment and had a good conversation with the PAC on that yesterday. In terms of other things that I've been up to, obviously out and about, talking to the BMA General Practitioners Committee, talking to some of the life sciences companies, particularly around new medicines, on health and work in the West Midlands, with Sue at the Chief Scientific Officers Conference and so forth. But I think the substance of what we've been doing, frankly, as an organisation, has been trying to get the 17-18 operating plans to the best place we can, and I think we're in a much better position than we were last year, although there are still significant gaps in some parts of the country that need to be worked through, and framing our overall work plan for the next 2 years in the context of the next steps on the NHS 5-year forward view document, which is being published tomorrow, and we have a chance to talk about that later on, so I won't go through that now.
Good. Any questions, comments for Chief Executive? No, in which case let's move straight into item 5 on the agenda, which is the mandate and business plan for 17-18. Will you introduce this, or is it to be in?
I'm happy to.
Okay.
Yep. So, I mean, the framing of this is that, as the paper says, we are required to publish our annual business plan by the end of March each year. Tomorrow is indeed the end of March, and therefore tomorrow we'll be publishing this document. But it goes wider than simply describing the actions that NHS England will be taking to fulfil the requirements that the government set in the mandate. It is a broader system response to the challenges facing the NHS right now, and it sets out not only the practical steps that we aim to take over the next 2 years to improve services in key areas of greatest concern to the public, but focuses much more on the what and the how rather than the why of how we're going to bring about that change. So given that it is published tomorrow, obviously not going to break that by going into the detail here today. The board has had a chance to discuss now on several occasions the content, so this obviously is a collective endeavour, but I don't know what else, Malcolm, you want to cover at this point.
No, the only thing I would emphasise is the governance bit, because it's really quite hard to get formal governance around a document which is chameleon-like, changing some of its detail, not its key messages, but much of its detail over time. So just to reassure more generally that first we took at our last meeting a decision that sign-off would be by the Chief Executive and the Chair and Deputy Chair, and that is exactly what will occur. But the second, we put on that some conditions about engagement, and we've certainly observed that. I'm grateful to all the non-executive and executive directors of the board for their input and for the assurance that we are now in a position where we have a document that we feel is fit for publication, and more than that is a positive contribution to future thinking about the NHS. Throughout this, there has been extensive engagement and discussion with our various stakeholders, as I was saying before. So I think in governance terms, I'd just like the board to take some assurance that we are at a position of formal compliance with where we should be. David.
Just, Simon, clearly the delivery plan is being launched tomorrow. I'm intrigued. I think it's, one of its purposes is to mobilise the NHS in aggregate behind the critical priorities that have been set both in the mandate and from the various other elements. That involves, I think, engagement with our people as well as with citizens. And I'm intrigued as to what the process is by which we communicate and engage the people of the NHS so that everyone is clear about what we're trying to do, where we're marching, and importantly, the contribution at all levels that everyone can make to help take those priorities forward.
Yes. So there's obviously been a process hitherto, in that there are various sort of inputs to the framing of these priorities, as we know, the mandate that Malcolm has described, and in it this year, realism about the likely improvement trajectories around A&E 4-hour waits, RTT and so on. So we're reflecting those judgments that are made in the mandate. But over and above that, we obviously do direct work with public, with patient groups, and a number of them have been involved in formulating this, to the extent we are giving practical effect over the next 2 years to the mental health task force, the cancer task force, the urgent and emergency care redesign. They've already been the subject of big engagement, so we're sort of putting our best foot forward on turning those plans into reality. And then Health Watch undertakes an annual prioritisation exercise, drawing on the Health Watch branches around the country, that identifies the top things they think that the public want the NHS to focus on. So we've factored those in as well. It won't be a surprise to know that improvements in mental health services and access to GPs and better working between hospitals and the local community health services and social care were their top priorities, second year in a row. So that again is part of the reason why we're focusing so clearly on those. But obviously this is all kind of in the framing and the run up to tomorrow. I think your question was as much about what happens after tomorrow as it is where do we get to. So obviously there is a sort of large communications exercise to do with CCGs and trusts. But also we've been working with a number of voluntary and community sector partners on this, and are looking to sort of re-energise some of the commitments that were set out in the original 5-year forward view around how the change process has got to be more than just the statutory organisations in the NHS. And as part of what we're going to be saying in terms of further detail on how SDPs are going to develop, being clear about the broader local government role there, not just the social care aspects of that. So there's a sort of whole multitude of effort which is required, and there are actions that some of the individual ALBs, national leadership bodies themselves, will be taking. HE publishing a workforce plan for England, for example, next month.
Presumably a sort of a cascade within NHS England for its own people to engage them in the thinking, and therefore again how each and every person in the organisation can help make in their role a contribution to delivery.
That's right, and I mean both Jane and Bruce will be involved with their respective professional groups and stakeholders. There's a aspect of this which is sort of reminding people and laying out the big reform agenda that there is actually on nursing workforce that has emerged over the last 6 to 12 months. In the case of clinical leadership and frontline medicine, there are some practical things that we want to do to try and make junior doctors' lives easier, and so Bruce and colleagues have been involved in developing those with our partners, so that's in here as well.
Good. Well, thank you very much.